next disease, that is epilepsy. So what is epilepsy? Or it is a disease which is related to your neurology, that is it is a neurological disorder which shows unpredictable occurrence of seizure which can appear periodically, and this seizure get temporarily resolved or it is spontaneously. It means there is occurrence of seizure in epilepsy. I am repeating this: epilepsy, it is a neurological disorder in which there is unpredictable occurrence of seizure and which can appear periodically, and the seizure get temporarily resolved. And then in epilepsy the person may become unconscious during this seizure. If the seizure is occur, then the person it become unconscious during the seizure, and the duration of this seizure it is last about 2 to 5 minutes. It is for 2 to 5 minutes. And this epileptogenesis is a gradual process by which the normal brain develop a epilepsy. I am repeating here what is terminology, that is epileptogenesis is a, so what is epileptogenesis is a gradual process by which the normal brain develop a epilepsy. Yes, simply what is epilepsy? It means what? There is it shows unpredictable occurrence of seizure, and during the seizure a person become a unconscious. So this is nothing but a epilepsy. So what is seizure? Seizure, it is a over excitation of neuron in the brain. Yes, what is seizure? It is what? It is a over excitation of neurons in the brain, and due to this there is altered behavior with or without violent motor activity. Then the intensity as well as effect of seizure which is depend upon the part of brain getting affected. Yes, this intensity of seizure and the effect of seizure which is depend upon the part of brain which getting affected, and generally it shows presence of lesion, tremor, infection, or any other injury can causes a seizure. Yes, what are the causes of this seizure? For example, lesion, then tumor, then infection, and any other injury. These are the they can cause seizure. In most of the cases, or generally the cause of this epilepsy, it is idiopathic. You know the meaning of idiopathic, it means unknown, cause of the unknown reason. But in some cases it involves brain injury. Yes, but most of the cases the cause of this epilepsy it is idiopathic, it means unknown reason or unknown. But in some cases the causes of epilepsy or the cause of epilepsy it involves stroke, brain injury, brain tumor, infection of the brain defect. These are the few causes. For I am repeating cause. First, that is brain injury, then brain tumor, stroke, then infection of the brain, and the birth defect. Small number of population get affected due to genetic mutation. Another cause, small number of populations get affected during a genetic mutation. These epileptic seizures are the result of excessive and the abnormal neuronal activity in the cortex of the brain. Yes, this epileptic seizure or the epilepsy which leads or which result of excessive and abnormal neuronal activity in the cortex of brain. So this is the basic of epilepsy and seizure. So types of seizure, first that is parietal seizure, then second generalized seizure, and in parietal seizure first that is simple parietal or partial, then complex, and third that is parietal seizure involving to generalized seizure. In generalized seizure, first that is absence seizure, second tonic clonic seizure, then next myoclonic seizure, then atonic seizure, clonic seizure and tonic seizure. I am repeating. First that in parietal seizure, first that is simple, then second complex, and third that is parietal seizure involving or evolving to generalized seizure. In generalized seizure, absence seizure, tonic clonic seizure, myoclonic seizure, then atonic seizures, clonic seizure and tonic seizure. We will see one by one. This partial seizure or parietal seizure, this type of seizure which is characterized by local effect, that is seizure start with a particular area and remain confined to that area only. It is not to another. Yes, it means what? It is start at a particular area and remain confined to that specific area only. This occur mainly due to the lesion or the disease to the particular part of the brain. Yes, what is main cause? Or it occurs, or when it occur mainly due to the lesion or the disease to the particular part of the brain. In this seizure may or may not be cause a loss of consciousness, depend upon the type, and it can be divided into first that is simple, complex, and third that is parietal seizure evolving generalized seizure. First that is simple, it involves repeated involuntary muscle contraction limited to a single limb. Yes, this simple seizure, it involves what? Repeated involuntary muscle contraction. The in which there is repeated contraction of muscle, that it is involuntary, and which it is limited to a single limb. The duration of the seizure, it is for 13 to 60 second, 30 to 60 second, and consciousness is not lost. Then hallucination, excessive sweating and dilation of pupils may occur. Yes, hallucination, then excessive sweating, then dilation of pupil may occur. Then complex seizure, the duration of the seizure is for 2 to 5 minutes. Then it includes impaired consciousness, then automatism. Automatism, it means purposeless movement or emotional changes or the walking. Yes, automatism, it refers, that is purposeless movements, emotional changes or the walking. Then third, parietal seizure evolving to generalized seizure. The parietal seizures progress to a tonic-clonic seizure. Then next, generalized seizure, it is characterized by normal firing of neuron. Yes, it is characterized by a abnormal firing of it is characterized by a abnormal firing of neurons, that is excessive electrical discharges. Yes, it is characterized by abnormal firing of neuron, that is excessive electric discharges, and patient become unconscious. First that is absence seizure, second tonic clonic seizure, then myoclonic seizure, atonic seizure, clonic seizure and tonic seizure. We will see one by one. First that is absence seizure. In absence seizure, the epileptic activity occurs throughout the entire brain. Yes, this absence seizure is occurs throughout the entire brain. It is a milder type of epilepsy that cause unconsciousness without any convulsions. After the seizure, the person has no memory of it. Yes, of course, it occurs through the entire brain. After the seizure, the person has no memory of it. Ongoing activities get stopped and posture is not lost, and the duration for this, it is 2 to 10 seconds. and this seizure is called as petechimal seizure. This absence seizure is also called as what? Petechimal seizure. Then second, tonic clonic seizure. It is also called as grand mal seizure. Yes, I am repeating. This absence seizure is also called as what? It is called as petechimal seizure. Then second, that is tonic clonic seizure. This tonic clonic seizure is also called as what? It is also called as grand mal seizures. During this generalized tonic clonic seizure or the grand mal seizure, the electric discharges originate at a small area of brain and spread to entire brain. I am repeating. See here, during the seizure, electric discharges originate at small area of brain and spread to the entire area of the spread to the entire brain. Then in this there is temporary loss of consciousness. Then in this seizure usually lasts for duration, for this duration it is 1 to 3 minutes, but sometimes it is lasts up to the 5 minutes. In this there is muscle spasm or the muscle gets stiffened and person get fallen on the ground. Then second, next seizure, that is myoclonic seizure. Yes, in this seizure it involves jerking of muscles in a part of the all of the body, jerking of your muscles. A hand may suddenly fling out, shoulder may shrug, or foot may kick, or entire body may jerk. Then atonic seizure, it is also called as drop attack or the akinetic seizures. Yes, atonic seizure is also called as drop attack or the akinetic seizure. And in this seizure, the person get fall on the ground due to the excessive relaxation of muscle. I am repeating, in atonic seizure, what will happen? In which there is the person get fall on the ground because of what? Or due to the excessive relaxation of muscles, and the secretion of inhibitory discharges increases. After a few seconds, the person regain consciousness and can stand and walk again. After a few seconds, the person can stand and walk again. Then clonic seizure. During a chronic seizure, a person may lose a control of body functions and begin jerking in a various part of body, or temporary lose a consciousness followed by confusion. Then tonic seizure. In this type, tone is greatly increased and the body, arm, and legs suddenly become stiff or the tense. So this is the these are the types of seizure. Next, that is types of epilepsy. On the basis of intensity of seizure, first that is grand mal epilepsy and second that is petechimal epilepsy. On the basis of intensity of seizure, first that is grand mal epilepsy and second that is petechimal epilepsy. Other type, first in that juvenile myoclonic epilepsy, then benign parietal epilepsy in childhood, then solitary parenchymal cyst and reflex epilepsy. This reflex epilepsy, the specific event or action become responsible for attack of epilepsy, like photosensitivity, hot water, cold water, or visual stimuli. Next, that is pathogenesis of epilepsy. Here we can see the pathogenesis. The imbalancing of few neurotransmitters may involve the development of epilepsy. Yes, the imbalancing or the misbalancing of few neurotransmitters may be involved in the development of epilepsy. First neurotransmitter, that is GABA, that is gamma aminobutyric acid, is an inhibitory neurotransmitter and it reduces the neuronal excitation. Yes, GABA, that is gamma aminobutyric acid, is a neurotransmitter. It reduces the neuronal excitation. Then second, glutamate neurotransmitter and receptors. For this neurotransmitter, there are two receptors are present in CNS, that is NMDA, N-methyl D aspartate, and NMDA. Then NMDA, which is responsible for neuronal excitation, and NMDA, which is responsible for inhibition of neuronal activity. I am repeating, NMDA, that is N-methyl D aspartate, which is responsible for what? Excitation of neuron or the neuronal excitation, and the NMDA, which is responsible for inhibition of activity of neuron or the inhibition of neuronal activity. And this NMDA receptor generally modulate calcium and sodium channel openings of which causes excitation of neurons. Here we can see potassium stimulated glutamate release, then decreased production of GABA, increased excitation of glutamate receptors, then rapid recovery of inactivated sodium channel, that is Na plus channels. This the generation of seizure in that first, that is reduction in inhibitory synaptic activity or enhanced excitatory synaptic activity causes a seizure. Then second, the presence of potassium ion generally stimulate the glutamate release, and due to which the excitatory NMDA receptor gets stimulated, and which plays a major role in epilepsy or the generation of seizure. It is NMDA. Then the state of Na plus, that is sodium ion, plays a major role during firing of neuron or the neuronal firing. Then this is important for firing as a recovery from inactivated state to activated state. This Na plus channel is essential for generation of action potential, and this Na plus channel, that is sodium channel, fastly recovered to activated state in epilepsy. Next, that is causes of epilepsy. First, that is genetic influence, then second, head trauma, then third, brain status, then infectious diseases, then prenatal injury, then developmental disorders, risk factors, age, then family history, head injuries, stroke and other vascular diseases, then dementia, brain infection and seizure in childhood. We will see one by one. I'm repeating. First, causes of epilepsy, genetic influence, then second, head trauma, then next, brain status, then infectious diseases, then prenatal injury, then developmental disorders, risk factors, then age, then family history, head injuries, stroke and other vascular diseases, then dementia, brain infections, seizure in childhood. We'll see one by one. In genetic influence, in some cases or people show genetic influence. That is, in most of the cases, genes are not directly involved in generation of seizure, but they increase the risk of attack of seizure. And certain genes may causes or make a person which is more sensitive to the environmental condition, and that causes a seizure. Then head trauma. Head trauma as a result of accident or any traumatic injury, and which can cause a epilepsy. Head trauma as a result of or due to the head trauma, that is accident or the other traumatic injury, can cause a epilepsy. Then brain status, that is the condition of brain that cause damage to the brain such as brain tumor or stroke can causes a epilepsy. The stroke is a leading cause of epilepsy in adult that is older than age that is 35. Stroke. Then next, that is infectious diseases. The infectious diseases such as meningitis, AIDS and viral encephalitis can causes the epilepsy. Then prenatal injury, that is before birth babies are sensitive to the before birth babies are sensitive to the brain damage, then that could be caused by several factors. For example, infection in the mother, poor nutrition and the deficiency of oxygen. Then developmental disorders, for example autism and the neurofibromatosis. The risk factor, there are certain factors which may increase the risk of epilepsy. Then age. The onset of epilepsy is most common in children and older patients, but the condition can occur at any stage. Then head injury. Yes, head injury, it is also the cause of epilepsy. You can reduce your risk by wearing a seat belt while riding in a car or by wearing a helmet while bicycling. Yes, then stroke and other vascular diseases. Vascular, it means your diseases which are related to blood vessels. Stroke and blood vessel diseases can cause a brain damage, and that may causes it causes a brain damage, and due to this it causes epilepsy. You can take a number of steps to reduce your risk of this disease, including limiting or reduce the intake of alcohol, or the avoiding smoking, or the avoiding cigarette, then eating a healthy diet, or the exercise or the regular exercise. Then dementia. Dementia is also increase the risk of epilepsy in older adults. Dementia, it means temporarily the memory loss. Then brain infections, for example infections such as meningitis which cause the inflammation, TIS. Last TIS, it indicate inflammation in your brain or the spinal cord. It also causes or it also increase the risk of your epilepsy. Then seizure in childhood. High fever in childhood can sometimes be associated with seizure. See here, seizure in childhood, it means high fever. Fever is in childhood can also sometimes associated with seizure. Yes, the children who have seizure due to high fever generally won't develop epilepsy, and the risk of epilepsy increases if child has long seizure. Yes, these are the number of causes of epilepsy. Then next there is complications. In complications, there is cognitive problem, for example problem in thinking, problem in writing, problem in walking, then problem in remembering, or the behavioral difficulties, then intellectual personality, for example humorlessness, then dependence, anger, hypo or hypersexuality or emotionality. Then memory loss, it may be short term memory loss. Then prolonged aimless, then violent behavior, that is aggression and the defensiveness when subjected to a restraint during a seizure. Then tongue, lip or cheek injury caused by beating. Then skull or the vertebral fracture, shoulder discoloration. Then aspiration, it means inhalation into the lungs of aspiration of secretion or the omitted stomach content, that is inhalation into the lung. These are the few complications of epilepsy.